What is a biopsy for cervical cancer? Imagine a tiny sample of tissue from your cervix holding the key to understanding whether cancer or abnormal cells are present. That's what a biopsy for cervical cancer is all about. It's a simple but crucial medical procedure used to confirm diagnosis after screening tests like Pap smears or HPV tests show abnormal results. Sometimes, symptoms like unusual bleeding or pain also lead doctors to recommend a biopsy. This process helps determine if the changes in cervical cells are benign, precancerous, or cancerous, guiding the next steps in care. There are different types of cervical biopsies. The most common is the colposcopic biopsy. During this procedure, a speculum is inserted into the vagina to gently open it. A colposcope, which is a magnifying lighted instrument, is used to examine the cervix closely. If areas look suspicious, a small tool called biopsy forceps pinches off tiny pieces of tissue from those spots. Sometimes, a special dye is applied to highlight abnormal cells, making it easier to target the right areas. This procedure usually causes only mild cramping or a quick pinch sensation. Another type is the endocervical curettage, where a small spoon-shaped instrument or a brush scrapes cells from inside the cervical canal, the passage connecting the uterus and vagina. This helps sample areas that aren't visible on the surface but may still contain abnormal cells. For more extensive sampling, a cone biopsy, also called conization, may be performed. In this procedure, a cone-shaped piece of tissue is surgically removed from the cervix using a scalpel, laser, or an electrical loop device. This method often requires local anesthesia or sometimes regional or general anesthesia, especially if a larger tissue sample is needed. It's typically used when doctors need a deeper or bigger sample to understand the extent of abnormality. During the biopsy, local anesthesia is usually applied to numb the cervix. The doctor gently holds the cervix steady with forceps and carefully removes tissue samples to avoid crushing the tissue, ensuring accurate results. Afterward, some bleeding or spotting is common, and patients might experience mild cramping. To promote healing, doctors usually advise avoiding heavy lifting, sexual activity, or tampon use for a few days. Serious complications are rare but can include heavier bleeding or infection, so follow-up care is important. The importance of a biopsy cannot be overstated. It provides a definitive diagnosis, confirming whether abnormal or cancerous cells are present. This information is vital for planning appropriate treatment and staging if cancer is found. It also helps in monitoring precancerous changes before they develop into more serious conditions. Understanding the biopsy process is essential for early detection and effective management of cervical cancer, which can help preserve reproductive health and improve outcomes. If you ever need a biopsy, remember to discuss all your questions and concerns with your healthcare provider. They are your best resource for personalized advice and care.